This conference will now be recorded.
Well, first of all, folks, good morning, everybody. Just want to take a moment and remind you that this call will be recorded, as you just heard, and will be posted on the Chamber's website a little later this afternoon. We are pleased to have members of the media on the call as well, and those speaking should anticipate some media attention as a result of this call as well. And lastly, I respectfully ask everyone to put your phones on mute until we're ready for the questions and answers at the conclusion of the call. Uh, and so, with that in mind, I'm going to ask if Kenny Rena, are you on right now? Kenny will be joining us shortly. Uh, Kelly, anything to report on your end that you want to cover before we introduce Kristi Taylor?
Well, if you're in Nacogdoches today, get hungry and go to Panda Express and mention the Leadership Nacogdoches project support. Today only, 20% of meal sales, food sales will go toward the Leadership Nacogdoches project, which is for Family Crisis Center of East Texas. So get with the chamber later, or I'll put something in the chat about that as well. Panda Express today.
Thank you, Kelly. And Gary Lee Ashcraft, we're headed toward, I know that you're no longer CEO, but you do have the doodad ahead of you. What's going on there?
I don't know. I'm no longer the CEO. I think Caroline's coming on here in a bit if she's not here, and she can answer all the questions. I'm retired.
Uh, well, I hope you're enjoying your
Very
retirement.
helpful, Wayne. You're welcome. I
That's
know it's going to
great.
be April 29th. April 29th, Expo Center. Lots of
And
barbecue.
Aaron Wyndham, I do believe there's an event going on next week you're involved with, is it not?
You betcha. Noble Scholars Reception Monday, April 3rd, where we will recognize and acknowledge those awesome seniors who have put in some extra work over their high school careers all around the county at SFA Monday evening.
And how many do you anticipate, Aaron?
Actual Noble Scholars, over 200, Sherry, isn't there? Our goal for the last couple of years was to get the number up to 250. That would be half the seniors in the whole county being Noble Scholars. And I think we're real close to that. If we're not there, we're very close to that. So that's exciting.
Well, that's great. And we're certainly looking forward to that big event on Monday night. So, well, I'm now pleased for the purpose of introduction to introduce Kenny Rena with Burke. Kenny has been a close colleague of mine since I've been here at the Chamber and been very helpful in a number of different ways, especially helping us uh, formulate our legislative priorities as it relates to mental health issues in Nacogdoches County. In addition to that, her leadership at United Way is almost legendary. She's done a tremendous job as a past chair, I believe, of that organization. And she has very uh, graciously agreed to introduce our featured presenter today. Kenny, good morning.
Good morning, Wayne and fellow chamber stakeholders. It's great to see y'all today. I am in a frantic, fun state. We are kicking off our Mission Possible conference. Today is about 230 mental health professionals are joining us here in Lufkin this afternoon and tomorrow for a mental health professional conference. And just a little moment, there's a couple things I want to share, and then I'll introduce Miss Kristi Taylor. Just one little note is there is a number, and it's 988. If you or a loved one ever have thoughts of suicide, I recommend you have that number handy or remember it and call. And you ever have any thoughts is to call. I've heard of too many cases lately of people that may not have reached out and gotten the help that they needed. So we also have a rural access mental health survey that's going on. And as y'all know, surveys are important for decision makers across the state to know information about our communities. And we have a very low turnout for our region. I'm going to share that survey link with you guys today. And if you would please, as my friends, stakeholders, fill that out for us. And it's a HHSC, Health and Human Services survey for rural access. And I'll share that, and y'all be sure to check it out and do that survey. It takes about 10 minutes, maybe 5 minutes, but I'll share the link, and I'll share the file, PDF file as well, that you can share with your colleagues and friends. But let me get to Miss Taylor. I had the pleasure of meeting her in Austin at Nacogdoches Lufkin Days a while back, and she met with us and some other Nacogdoches mental health stakeholders about some of the issues and concerns that are going on here, some of the plans that we have in our region to address mental health crisis. And we were really pleased to get to know her and more about what the Commission on Mental Health is doing. And so she does have a long, it's Texas Judicial Commission on Mental Health, and I'm sure they get called a couple of different things. And but she's their executive director. She has over 25 years of experience as an attorney and policymaker, and has a BBA with honors in finance from Macomb School of Business and a Juris Doctorate from the UT School of Law. Taylor represents children and parents in the child welfare system for 7 years. In 2017, Ms. Taylor spearheaded the planning for a new judicial commission on mental health and was named the executive director in 2018. She's been nationally recognized for her groundbreaking work with the JCMH, including the development of the Eliminate the Wait campaign and the Texas Mental Health and Intellectual and Developmental Disabilities Law Bench Book. And I have seen that book, and I know some of our leadership keep it handy and use it on a regular basis. She's an educator in trust-based relational intervention and a facilitator for Policy Research Associates, sequential intercept model mapping. I think Wayne picked me to read those words to use this morning. But I'm pleased to see Ms. Taylor again, and glad that she is here to speak to us and share a little bit of what we learned there in Austin of what they do. And she has some great resources that we're looking at tapping into to train some of our leadership here in our region.
Thank you so much. Good morning, everyone. I have slides. If you want me to share slides, I'd have to get permission from the organizer, but I can also just talk with y'all. It's a small enough group that we can just have a conversation, whatever you prefer. But good morning, and okay, great. I'm able, I think, to share now. Good morning. Thank you for being here. Just to explain where we started, this is a photo of the two high courts in Texas, the Texas Court of Criminal Appeals and the Texas Supreme Court, meeting back in 2018. They all got together, and we brought in a lot of stakeholders like you who are in the field working with people with mental illness in your jails, in your communities, and telling the high courts what the problems are and what you need. And so with that, they were able to form a Judicial Commission on Mental Health. And we have been around 5 years now, and I know that you all have a reason that you do what you do. We all could be getting paid more doing, something in the private sector, something probably more glamorous, but we all are civil servants, I think, for a reason. And this next slide is one of my reasons. This is John, who was the son of a friend who called everyone she knew. She contacted the commission early and said, my son is not well. He has a diagnosis of bipolar with schizoaffective disorder. He took our car. We don't want to press charges, but he landed in a county where they don't know him and they don't know us, and they're going to go ahead and prosecute him. And so this led to him being ordered to go to a facility that was not exactly appropriate for him. It was a facility that said they did both mental health and substance use, but they were a lot more focused on the substance use. And they ended up being one of those kind of tough love organizations that said, why are you 30 and still living with your mom? You must be a loser. And, you know, really, really pushing hard on the substance use part, but that wasn't his main diagnosis. And so this poor mom called everyone she knew. She called the attorney, the judge, you know, anyone that would answer. She called me and I said, we don't take direct representation. We're here to create policy and education. And she saw it coming, and her son walked out of that institution and jumped off a bridge. And she knew it was coming, and she saw it, and as a system, we failed. And I know that you all know families and John's, and so I think that's always good to start with that. We take those families into our hearts, and we think about, you know, what can we do to make it different. Let me stop my share for 1 second. Sorry, this is different than what I'm used to. Okay, I'm going to flip through some slides, so just close your eyes so that you don't get dizzy, because I'm going to go down to some slides, okay? So right here on collaboration, I think this is where you all are. I think it's wonderful that you have your Chamber of Commerce, you have your local mental health authority, and so many stakeholders in your community gathered. And that is what we see can make a huge difference in the lives of people like John. So some of the things that we recommend, you may already be doing with this organization right here, but one is a quarterly systems improvement meeting. And so that meeting is to be more of a big picture look at how are we doing as a system. And when you go through that entire sequential intercept model that Kenny just mentioned, how are we doing from section to section? And as a commission, I would recommend that you look at 3 or 4 main areas that are supported by mental health law and that are supported by our commission, that we can give you resources to help you look at this. But one is your, when you get together as a collaboration, look at your civil commitment. How are you doing on emergency detentions? We have a lot of communities that say, you know, our civil commitment's very disconnected from our criminal system, and they're not talking to each other. And a lot of times it's the same folks that really could benefit from having a civil commitment rather than waiting until they break the law and cross over into that criminal justice system, which we know then stacks up, leads to felonies, and can be much more difficult to get someone out of that system into treatment. And I want to start by saying, you know, we're not talking about violent criminals who are a threat to the community. We're talking, let's start with the folks who are loitering, who are getting those public intoxication charges, who are bothering your businesses because they're homeless and they're ill and they're scaring, you know, the families that are coming into the businesses. And so instead of those folks getting those criminal charges and taking up bed space, which we know is really expensive in our jails, and then waiting to go into our state hospitals, maybe we could catch them earlier and work with our local mental health authorities, with any private hospitals, and try to do better for them. So that one, the first step I would say is your civil commitment. The second is your identification and diversion. So when people do cross over into the criminal justice system, are we noticing? Are we paying attention? Do we have those flags on the system that say, this person we think might have an intellectual disability? And you don't have to be a doctor. You don't have to know without a reason of a doubt. You know, you just can have a suspicion that, you know, I've known this family and I know that kid had problems in school. And, you know, it can just be, I think this is someone we should pay some special attention to. And you flag that, and they get a deeper look with the local mental health authority. And so under that umbrella of catching people early and diverting is also, would our community benefit from a diversion center? And, you know, these can be expensive because you have to have a physical building, but, and you have to have a lot of people agree. But they can be very helpful, even if they can only house 5 people to start with. because rather than law enforcement having to take the time to drive somebody across town, sometimes across the state to find a bed, there's some place that can help stabilize people who just really need that first attention to route them to the right place, to see if they're on their medication, and to get them started right. So that's something that your community can look at. And then also our mental health courts. We support judges in developing, and it doesn't have to be a full-blown court, but in developing a docket. We have actually just finished a video that we're going to put out on how to get that started. So it could be a judge who says, I'm going to try this. I'm going to talk to my local mental health authority, and I'm going to talk to my prosecutors and my DA and find out what our community is comfortable with. And if there are certain offenses that we know we could put into this separate docket and really give them a treatment focus, then that's a great resource. And we've had a lot of success with that, people really getting their lives on track. I want to say, if there are any questions, please stop me. I'm just going to throw some information at you, but it's always better if it's a discussion, and I know there's a lot of people in this call with a lot of expertise. One thing I would bring up is people don't know about this law and the books about information sharing. It sometimes can be a barrier when we talk about HIPAA. And there's actually a law in the books, this Health and Safety Code 614-017, that says if it is in the purpose of continuity of care of bringing the special needs offender into a collaboration where the defense attorney and law enforcement and the judge and prosecutor, when everyone is going to sit down and talk about what would really be best, rather than just kind of shuffling this case through, what would be best for this person, well then you actually don't even need HIPAA waivers. A lot of times HIPAA waivers will make us feel better when we're not used to this law, but just go look at this sometime, because there's a long list of who is required to share information. So it's not just you can if you want to, it actually says you shall disclose and you shall receive information if you are one of those stakeholders that's involved with this. So I said something about civil commitment. We hear a lot of problems, and actually we just released a report on emergency detention. So you can go to our website to look at that. But we know that emergency detention is accomplished a lot of different ways. Now, do you know in your county if law enforcement, if they will use their power to emergency detain someone? Does anyone know? You raise your hand. Some communities, law enforcement does it. Some, it's only by warrant of the judge. Does anyone know where y'all fall on that? Kenny?
Crystal Odoms might be able to answer that. She is our clinical coordinator for our mental health clinic.
Well, I don't want to put anybody on the spot. I'm just saying it's something, something to think about, is that there are these different ways that when somebody is going to harm themselves or others, or they are so ill that they are not taking care of themselves, that either law enforcement can spot this and put somebody under emergency detention, or a family can go to a judge and say, we need to get this detention. And you've heard of this before, where there's a 48-hour period and doctors have to see the person and then decide whether they're going to go on with that civil commitment. So civil commitment, is a big deal. Like, we don't take that lightly. It's the stuff nightmares are made out of, right? That you wake up and that you've been detained. But if you're thinking about someone who has a clear mental illness and they are getting into trouble with the law, a civil commitment is preferred to racking up criminal charges that are later going to prevent your ability to get housing, jobs, things like that. So it is something that we would recommend when you're looking at your whole system to see how is your civil commitment system working. And this is a slide. Yes, go ahead.
Sorry. And just to let folks know, and I think it may change, since I work with 12 counties, but we do, I know, have our local advisory board, and I think Nacogdoches might have met today, and they consist of our law enforcement, our hospitals, and our Burke individuals, and our judges, and as many people as we can get at the table, but they do meet quarterly and work on that as far as, well, if somebody is at risk of danger to themselves or others, that we are able to do an assessment. We have a mobile crisis outreach team that can do an assessment, and then we do have a facility that can do that in involuntary hold, and so that 48-hour hold that works with them to get that care, and that's our mental health emergency center. So I think that we've been working on that for a while, and then with some of this, we're hoping to be able to do even more.
Great. Okay. Well, moving on, when we talk about diversion, I know a lot of our rural communities say divert to what? You know, we are not the Harris County that has this giant center that we can take everyone to. And so we do try to remind people that not everyone needs that brick and mortar place, that we've seen a lot of creative solutions like that MCOT team that Kenny is talking about. Some people may be able to be stabilized if the MCOT team comes out to meet them. They find out who their people are, if they have any people left, you know, in their lives. But some people can be stabilized and released on a bond to their family, and you wouldn't need that sort of brick and mortar diversion center. And then we talk about some people may initially need to be locked up, may be in jail, but if they receive the right medication, they might be able to be stabilized and then not wait on that really long wait list to go to state hospitals. So there are different options and things to think about. Here's some information about mental health courts in Texas. Right now we have only about 27 adult programs and 11 juvenile. And again, it sounds really expensive and difficult to do. And so I love that on our video, we have one judge from Midland County who says, just think of it as a docket. She said, I went to my local mental health authority and said, can you do 5 people? Can you commit that we're going to have 5 people in this court? And that is how she ran through that program. So here is a list of some of the counties that have, and some are the ones you would expect, you know, the big counties, but we have Montgomery, some of the smaller counties, Uvalde, and that judge from Midland. So McLennan, you know, some of these counties are surprising us. And here are the counties with the juvenile mental health courts. Okay, another big issue, when I said there are 3 or 4 issues, let's just say 4. The first is civil commitment. The second is early identification and diversion, and the third is competency restoration. And competency restoration is a big, complicated topic, but if you think of it like this, that you have constitutional rights, that if you don't understand the charges against you, and if you can't assist your attorney in the defense for the crime that you're being charged with, then that's not constitutional for you to proceed. So we have to make sure that people are in the right place for this. The problem is it's become like, if everything, you know, if you have a hammer, everything looks like a nail. It has become like that every single person who seems like they have mental illness, sometimes it's tempting to say, we'll just say they're not competent, you know, maybe they're not competent, but we'll put them through that long list. And what's happened is we have 2,500 or more, it's been hovering right around that number, people waiting to get into state hospital to get their competency restored. And so you can imagine if someone has a misdemeanor, the longest they're going to be held is 6 months. Well, that list is 2 years. So there's no way you're going to get through that. You're going to get any help. You're going to time out of your offense and have to be released before you're ever going to get to the state hospital. So one thing that we have been asking judges and attorneys to do is to really understand that competency restoration should be saved for offenses that are serious and that really the state has a strong interest in pursuing. So there's legislation right now that we are trying to get moved through that we've submitted to our Judicial Council, and they're working on in the legislature to say if it's a misdemeanor, maybe it doesn't really need to be in that competency restoration list. Let's look at other options. Let's look at, do you have outpatient competency restoration? Do you have jail-based? And again, when you're a smaller community, that feels very challenging. But some of those programs can be started at a very small level. And I know the legislature is very interested in pushing money through HHSC, through the local mental health authorities to the communities to be able to start some of these programs. And I've seen a jail-based program, and it wasn't as intimidating as you would think. It was, you know, you take some inmates out that meet that requirements and defendants, and they have a school program. And it really just took a small room, someone trained to do it, and to kind of keep the metrics and the data on it. But that was a way that a community can take back this crisis and say, we're going to handle this ourselves. We're going to not wait for the state to fix this problem, even though the state is working very hard to fix it at the same time, but we're going to take that back ourselves. And this slide, I think, is just to show you that right now, the way the law is written is it's very easy to get on this train of going to state hospital, because all it takes is a suggestion of incompetency. And then if a judge or an attorney is looking at the law, they're going to say, oh, I have to do this, even if it's just somebody, you know, criminal trespass, they were on somebody's business. If they're incompetent, the law is telling me in Texas that I have to send them all the way through to the state hospital. And so the reason that is, if y'all will remember, 30 years ago, no one was getting competency evaluations. It was, the law was written at a very low bar because we were often ignoring people that really did need that evaluation. And so it swung the other way. And y'all have been in the systems long enough, know these systems swing. It's a pendulum, you know? So we used to have no one getting evaluations, and now everyone's getting an evaluation, and our system is backlogged. And with our workforce challenges and things that y'all are experiencing in your local level, the state hospital is completely backed up. So we are asking everyone to reserve competency restoration for those serious cases, to try other things when it's a low-level offense. And there are also some suggestions from HHSC on how you can monitor that wait list. I don't know if anybody here knows how many in your county are on the wait list for competency restoration, but one really good practice, again, with that collaboration is to monitor that list, to have you know, that big quarterly meeting I talked about for the whole system, but then to have a weekly meeting where you're going over the cases and you're saying, all right, we've got, you know, Joe so-and-so sitting in jail waiting for the state hospital. Could we try court-ordered medication? Well, we've never done it here, or we haven't done it here in 30 years. Could we try it on this one case? It seems like an appropriate case, that medication has worked well in the past for him, and he is sitting in jail. He's getting sicker and sicker, and maybe as a community, we can come together and try that forced medication on this person or that person, and a lot of times they will restore right then. They move out of jail, they move back into the community with some support, with connections, you know, to your private providers and your local mental health authority. But it is something to think about. In my introduction, they mentioned eliminate the wait. These are checklists that are divided by profession. And they just kind of jog your memory about these things that I'm talking about. All this information can be overwhelming. And we think about this all the time. So we wanted to write it down and show you where the law is and say, you know, if you're the jail staff, if you're the sheriff's staff, this is your checklist. If you're the local mental health authority, this is your checklist. Are you thinking about these little small things? And are you thinking about these big system things that we can change? Someone earlier mentioned our bench books. These are on our website. We walk through all the mental health law that I'm talking about because it's a lot, and it's searchable is my favorite feature. You know, you do the the Control F, and then you can search whatever word you're looking for. We also print these out because I want both. I want one that's hard copy that I can mark up and tag, and I want one that's online. And then the fourth area that you can also find in this bench book is the reentry. As a community, are we thinking about, once people go through this and say we did all this work and we got them medication and they restored to competency and they're moving out of our jails and they're doing better, are we just going to drop them at the bus stop and say good luck? Or do we have connections to services? Are we helping them find housing, employment? Are we making sure that they have supports, peer supports? I don't know if that's something that your county has thought about, but there's a lot of success with people who've been through the system that want to give back, that come back and say, I'll hold your hand through this and I'll walk you through it. So those are some ideas. Let's see some more resources. We have a forums bank. So when the attorneys and judges are and local mental health authority are looking to do some of these things, you can look to our forums bank. And then a SIM mapping. So this is an example of the sequential intercept model. You can see we start on the left-hand side with the public health, hoping that we're educating our public, our families, and where they can recognize, you know, I think my son is struggling, and I think that I'm gonna seek out help. That if we had more awareness very, very early, then those are people that could be getting their needs met before they're in crisis. And then we go all the way through the system, and oftentimes, you know, it's a revolving door. But what we have in white are some of these best practices we've been talking about that community can embrace, that will help somebody from cycling through like that. And again, I'll end on, these are some of the resources that we offer. We're creating a video library because I know me, when I hear something new, I'll hear it and then I need to hear it again and I need to hear it again. So I'm thinking a video library where in the privacy of your own office, you can watch a video and find out exactly how to do some processes. We have our bench books. We offer that SIM mapping that we were talking about. We come into communities and gather everyone and walk through, when someone is ill in your community, what's the first thing that you do? What's the next thing? What's the next thing? And get people talking. And sometimes in communities, it will be one stakeholder group, you know, and I don't know the dynamics in your community, but y'all all may be thinking, oh, I know who that is. There may be one stakeholder group that's a holdout that says, I'm not interested in that. And sometimes those sorts of meetings can bring in the people that are the holdouts to say, this is what you need to know about this, and this is what your part is. And then we have the mental health court support. We could meet with judges and help them build that. We can connect them to a judge who just started one. And they, you know, there's nothing better than someone in your same shoes when you're trying to answer those questions. And then we have some legislative initiatives. And I want to let you all know too, we have a free summit in October. This year it's going to be in Galveston. And so we'll have a big in-person conference, and then we also have a virtual streaming option. And so that is a great way to network if you get to go. And we record all those sessions again so you can watch them again, and they come with a lot of information. So I threw a lot at all of you. Are there any questions or any comments?
First of all, Kristi, thank you. And I will have questions in just a second. Mary Ann, did you have a question of Kristi?
Yes, thank you, Wayne. Good morning. Kristi, from your perspective, what are some things that can be done at the high school or even junior high school level in terms of prevention or providing resources to families? Because we're seeing so many youth with increased mental health challenges, and a lot of the families that really need the help and support, you know, don't have the wherewithal, the resources to even know who to contact. And many times their kids are already in jail before they can take advantage of these, these interventions that you're proposing. So how can we do better as a community, or how can we better assist our youth with these type issues?
Such an important point. Again, the earlier that we can identify somebody who's struggling, the better. So I would say do you have a NAMI program, a National Alliance of Mental Illness? Sometimes they can be very supportive for families. And right now I know that the Meadows Mental Health Policy Institute is working really closely with education and trying to support our teachers and our counselors so that they can have the resources at their hands. And our leadership is very big on, just old school brochures. She said, our one of our co-chairs has a child with intellectual disability, and she said she found out through the schools that someone had a brochure and sat down and talked with her and said, I'm seeing some signs with your son, and you need to educate yourself, get in touch with if they're very young, the Easter Seals, the March of Dimes, and some of it's very particular. Like I know United Way is very, very strong in some communities. So I'm not sure in your county what the best source is, but I think having a discussion like this and saying who's going to take the lead on this, that it's a priority and that we are going to articulate that, and we're going to put dollars behind that, I think makes all the difference in the world. But
we're pleased, Kristi, to have both the United Way president and CEO on this call, along with Kenny representing Burke. So we've got two of our heavy hitters in the mental health community on the line here. Kristi, just a question. They're touting the surplus on the state level in the state budget. Is it likely we're going to see a real strong commitment financially to the mental health services for Texas?
I think so. I'm seeing a bipartisan push, and now I think it's going to come down to where is it going to land, and how does it get divided up. But I've heard support for more grant programs. I know that HHSC is looking at all sorts of interventions, like regional supports, where maybe there would be a person per region that would be focused just on these issues. And they've asked for things like their own funding to be able to directly grant for those sort of drop-offs or diversion centers. So I think that I think it's going to be the theme. And I know we have asked for additional funding for those sequential intercept mappings. And this, we already had funding to do some adult systems, but to your point, we have just asked for mappings for youth systems, so that and I know that HHSC is also doing this for free for communities, so that we can come into a community for free and map out when a youth starts to get in trouble, what are our safety nets before we're in the juvenile justice system, before we're in severe mental health crisis. What are the referral sources? What are the strengths of this community? And are they all connected in that referral, web? Do we all know what the other one is doing? It's amazing. Even, in smaller communities, I've lived in them. Maybe the left hand doesn't know what the right hand is doing. And maybe one nonprofit has always done one thing, but they received a new grant and they're able to do more. And you need to know about that. You need to know about the new initiative that they have. So I would think that the sequential intercept mapping is a great step for that. And if you guys are interested, we will put you on our list and talk to you about that further.
Well, any information you want to pass along to us, Kristi, let us know. We'll be glad to distribute it to our membership, and I'm confident my other stakeholders here would be willing to do that as well. Those are engaged in here, so that's great. So, any other questions of Kristi?
I would just like to say this is an excellent conversation. that I'm super proud of the chamber for putting on the forefront, because it is important to business and to our community, the wellness of our citizens, and it's something that we don't talk about enough in these particular circles. I see some of my favorite frequent flyers who we have these conversations in other circles, but to have them together with you at the chamber is super important. And I'm at Nacogdoches ISD, Kristi, and I would love to have as much information. I think that when we have meetings, interagency meetings, we have them, but I don't think we're talking about the right thing. And so I'm excited that this conversation is happening, and I hope that when we do meet in conversations like this, that we will say, what can we do? Sometimes we meet on these meetings and we tell everybody what we're doing and how that is helpful, but also we need to ask of each other, what can we do together and how we can move forward. So I'm writing as fast as I can some of the things you were saying, Kristi, but I would love to have more information on the youth resources you were talking about.
Absolutely. I will follow up with all of you. And Wayne can share all of that with you. And I want to commend you for this public-private partnership. I think that it is a model that will be the answer. That in Texas, we have successful businesses that care, and a lot of times they're not yoked up enough with the community, the places where the community is lacking, the community needs. And for you guys to have the foresight to make this connection, I think is really leading the state. We have seen those public-private partnerships save the day in other arenas, and child welfare, and you know, and other examples that we can look to. So I think that you're on the right track.
Thank you. Kenny, do you have something to add?
Yes, if I could, I would like to share our QR code before we get away, just to share that survey. If we can put that on the screen, if Kristi's done with her presentation.
Oh, yeah. Okay, yeah, let me. How do I stop it?
Kelly switched it over. She might have.
There.
Okay, Kitty may have clicked the wrong thing there. I'm putting it up there.
Okay, thank you, Kelly.
Sure. I think what Kenny was hoping is everyone on this call probably has not seen this. If you would just shoot that with your phone, I believe the survey, shoot that QR code. That it's a simple survey, and she'd really like to get all the input she can. So I think that was what we're going after there.
Great, thank you. Well, Kristi, I want to thank you for taking the time to join us today. You're welcome to stay on the call. We're going to hear next from our interim city manager, Keith Kiplinger, and we're pleased to have him join us. I suspect, like me, we heard a lot of new information here today. Good morning, Keith.
Good morning, Wayne. I was glad that I was able to jump on the call in time to hear Kristi's conversation, and I think most of Kenny's. So I think this is a great thing for us to be talking about in our community, and I'm really proud that the chamber hosted this. So thank you for that. It appears as though my camera is struggling to work today, but hopefully everyone can hear me at least. We have a lot going on at the city, and I just want to highlight a couple of things. We have a city council meeting on April the 4th. We're going to talk about really exciting things like a utility locate contract, a water meter replacement contract, but we are going to hear the update from the Expo and Civic Center. So that's always a highlight to kind of see where they've been over the past year. This weekend, the Living History event at Oak Grove Cemetery is from 10 to noon. If you haven't been to that, it's absolutely amazing. Some of our local characters that are still alive portray local characters that are no longer with us. And it's a really fun visit to Oak Grove Cemetery to learn a little bit about our town. We went last year. My daughter was in from college last year, and she had a blast. So if a 21-year-old Texas A&M student can enjoy it, and her old man can enjoy it, it's something for everybody. Wine Swirl is 5 to 9 on Saturday. So we've got a lot going on downtown. But what I'm most excited to talk about is our first quarterly neighborhood cleanup day. We're going to move this around the various quadrants of our city, as it were. But we're going to do this one in the southeast side of town on April 15th from 8 to noon. We're going to set up with a bunch of roll-off dumpsters at McCrimmon Park, which is on Woden Road, just inside the loop. We are not going to check your water bill when you come to drop off your old mattress or your old sofa. We're just going to take those really big things that have been sitting around your garage taking up space, Gary Lee. And so we're going to let you load those on the top of Charlotte's little car and drive them down to McCrimmon Park, and we're going to take them away from you. So if you've got some old tires, if you've got an old couch that you want to get rid of, this is an excellent opportunity. The plan is to do the southeast side of town, and then next quarter, maybe the southwest side of town, and then maybe move it up somewhere northeast and then northwest, and to try to do these 4 times a year. But if you live on Regay Street, you can drive to Woden Road to McCrimmon Park and drop it off. We're happy to take it. You can do an old stove, you can do some tires. Now you can't do a lot of tires, but you can do some tires. I think the limit is 4. So that's a great opportunity. And I'm happy to answer any questions anyone has.
Great. Any questions of the city manager? Well, I'm looking forward to cleanup day. I got a garage full I'll be delivering to you. Mary?
I have a question in that you said anyone could bring. Do you have some kind of flyer or something that we could get out to others on that information?
We do in English and Spanish. So can I send that to Wayne?
Yep.
Okay.
Please.
Thank
that'd
you.
be great. Well, thank you, Keith, for all you're doing down there. And we're pleased to have you at the helm of this great city. And if there's anything we can do to help you, let us know.
Thank you so much for inviting me.
Great. Well, I'm pleased to introduce next. Why don't we have Aaron? Why don't you give us an update on the NASD?
Good morning. Lots going on as the year is kind of on the downhill slope. We've got, of course, Noble Scholars coming up in a week, less than a week, Monday night. And as far as NISD goes, we have the Education Foundation NEF Scholars Banquet in May, where we're honoring the top 20 students and their favorite educator from NISD. So that's a first time event, and we're really excited about that. As we've got, testing is coming in and out as we wind down, and nothing's very calm right now. So Les is in a meeting, or he'd be right here talking to you himself. Again, like I said, the topic of conversation this morning is super important and important in our school district. Lots of things in the works to hopefully improve the mental wellness of our students.
Thank you very much. Any questions of Aaron? Aaron, what's the school update? While she's looking, is Sherry Cheney Morgan on the call?
Last day of school is May 26th. And yes, and I don't know if you've heard, but we've become a district of innovation as per our last school board meeting. We're really excited about that because that will change our schedule for next year, our calendar, and allow us to hire teachers earlier than we've been able to according to our calendar, and benefit us in several ways in terms of scheduling. So we're excited about that as well.
Oh, that's fantastic. And the good news, our superintendent has been nominated for Superintendent of the Year. So there you go. So, Well, great job at the NASD. I'm pleased to see our president and CEO of the Nacogdoches Area United Way, Caroline Garner. Good morning, Caroline.
Good morning, Wayne, and everyone else. Pleased to be here. Pleased to see all of you. United Way, we've got a busy month coming up next month because we have Do Dat Barbecue coming up on April 29th, a month from tomorrow. We're very excited about that. We've got a great number of cook teams already registered, but we are still accepting cook teams for just a little while longer. This could be a great team building experience, bonding, all sorts of fun way to promote your organization or just get out there with a family group and have fun. So that's something to consider, and just plan to come attend the event also. We need barbecue eaters and there will be the judging and music and a great family area. The event is sponsored by Pilgrims R&K Distributor, gives away free beer. You have a limit of 3, but that's plenty to wash down that barbecue. And then a family area sponsored by Williamson, and East Texas Community Health Services is going to be also offering free COVID education and vaccination. So we're very excited about Do Dat Barbecue a month from tomorrow out at the Expo Center. One of our agencies is having a fantastic event coming up on April 16th. That would be the Helping House. This is their annual Kite Fest out at the airport. That is from 11 to 4 on April 16th. It's a great family event. It's free to attend. Go fly a kite, literally, and have some food and other carnival activities going on out there. And that's about it, except that we did recently have a celebration of exceeding our fundraising campaign goal for 2023. We took a picture out at that thermometer sign, and that's been on social media. You can look for that in the Daily Sentinel as well. We're very appreciative for all the donors who helped make that happen. And then we also manage this grant from FEMA that goes to United Way Worldwide and comes to local United Ways. And recently, just last week, the local board for our Nacogdoches County EFSP, Emergency Food and Shelter Program, was able to allocate approximately $45,000 to go to local agencies. So we're very, very happy to have been able to help with that.
Well, that's fantastic. Any questions of Caroline? Well, thank you, Caroline, and thank you for the great work you folks at United Way are doing. And Do Dat sounds like another spectacular event ahead of us. So on the heels of the rodeo and Live After Fives and everything else that's going on. So a good week for the home team. And I want to thank all you folks who went to the rodeo, by the way. I understand they had a record crowd and just a tremendous 3-day event. Certainly the Expo should be very proud of the great work their staff did up there on that event. Tremendous event. So any other announcements from anybody else on the call? Well, the silence is deafening, so there you go. So, well, first of all, I refer you to the chat column if you have any questions. The interim city manager has forwarded to me the cleanup information, which I'll disseminate to everybody, and you'll have that information. I want to thank Kristi Taylor for joining us today. This is it's a sensitive issue, mental health, but it's critical to these communities. Anybody that's had a recent conversation with anybody involved in the court system or the sheriff's office is keenly aware of the challenges they're facing. I believe I heard Sheriff Bridges say at our meeting in Austin with Kristi and her staff that 40% of the folks incarcerated were in dire need of mental health services, and that's what's creating much of the logjam at the jails and in the judicial system. And hopefully working together, we can come up with some innovative solutions so that one, we can save lives, and two, save, be able to offer the types of services these folks need. It's a sensitive topic, but I think a critical topic. And I thank all of you for participating today. And Kelly, any other thing that we're missing in terms of upcoming events?
Well, we just placed a link to the Chamber's online event calendar. It's mobile friendly, so you might want to keep that up on your mobile device. So if you have a public event like the Do Dat Barbecue, you can include that on our calendar too. Thank you for doing that, Caroline. We are looking forward to a ribbon cutting on Thursday and more good things coming in April. If you want to be on our mailing list, just let us know.
Thank you, Kelly. If no additional information, I hope you folks all have a great day, and thank you for joining us today.